Hello everyone. The purpose of this video is to explain the procedure of using PPE appropriately for a COVID-19 call. This video will show donning and doffing of PPE and also the scouting system used to preserve PPE by sending only one person in to assess the patient when needed. The alarm room will screen the patient for COVID-related symptoms. They will advise the crew and ask the patient to await outside for EMS arrival. Upon arriving on scene, the crews will choose one member to be the scout. The scout will don PPE appropriately and approach the patient. When donning PPE, follow the procedure MEGG: masks, eye protection, gown, gloves. The mask will cover your face and both strings will go behind your head. Your eye protection will cover your eyes. The gown can be applied by tying the string prior to slipping it over your neck. You would then slide both arms into the sleeves. You will tie the gown behind your waist and have a partner help you adjust it. Next, you will put your gloves on and make sure they cover the gown. Before approaching the patient, grab a surgical mask for them to wear. When approaching a patient who is sitting outside and awaiting EMS, the scout should leave the equipment by the officer, take the surgical mask, and have the patient don it. Make sure it's covering their face, goes behind their ears, and pinches around the nose. If the patient is still inside the home, the scout should leave the equipment with the officer, take the surgical mask, and enter the home. When inside the home, the scout will assess the patient to see if they can walk outside. They will also give the patient a mask to wear and will assist the patient with walking outside. Once the patient is outside, the patient assessment can be completed by the scout while the officer remains at least 6 feet away from the patient. By doing this, the officer does not need to use a gown and their N95 mask may be reused. If the alarm room advises that the patient is unable to meet you outside and you feel that the patient might not be able to walk outside, the officer and the scout should both enter the home while wearing full PPE. The firefighter completing a patient assessment can make contact with the patient while the officer stands at least 6 feet back or completes their assessment from the doorway. At the completion of the call, the crew members will doff their PPE in the reverse order at which they donned it. They will first remove their gloves. After removing the gloves, you will use hand sanitizer to sanitize your hands, making sure to rub them together for at least 20 seconds. Next, you will remove the gown by tearing it from the back. The back should not have been touched by the patient. If so, you can wear a new pair of gloves to remove the gown. Continue removing the gown by only touching the inside and rolling it away from your body. Next, remove your glasses and set them aside to be cleaned later. If your N95 has been used for a potential COVID patient and you made patient contact, please dispose of it. Lastly, use hand sanitizer once again to clean your hands by making sure to use it for at least 20 seconds. To clean your eye protection after a call, use a cavi wipe or disinfectant spray to wipe and clean them down. The eye protection should not be disposed of unless they are damaged or too soiled to be cleaned. The eye protection can be reused for multiple calls as long as they are cleaned and properly disinfected. With appropriate PPE usage, the use of the scouting system, and by distancing ourselves away from the patient, we can reduce our exposure risks and maintain an adequate supply of PPE to use throughout this crisis. Thank you for watching, be safe, and have a great day.